Next up, Ed Marx, CIO for the Cleveland Clinic.
Give us an idea of the size, geography real quick, and focus. I think we assume everybody knows Cleveland Clinic, but...
Well, it's about a $9 billion organization, but what we measure is lives touched. Not the dollar amount, not the bed size, but lives touched. So we touch 1.8 million lives, and our hope is to really triple that, essentially, in the next 5 years. So we have our main hospital, the original hospital is Cleveland, Ohio. Been there almost 100 years. And since that time, we've branched out Canada, we've branched out to Florida, we've branched out to Abu Dhabi. We're going live with our first hospital in London in 2020. So we continue, and we have a lot of partnerships around the world, in China and other areas. So we continue to expand globally, but our heart and soul, it remains Cleveland and Florida. And again, we have some other states too, like Nevada, but heart and soul will always be Cleveland and Florida.
Yeah, I got to visit you up in Cleveland, and your CEO gave a presentation. One of the things that struck me is obviously the reach is amazing, and the research and the workflow and the things you guys do is really amazing. But the architecture of your Nevada facility, when I saw it, I was like, that's unique.
Yeah, I love it. The benefactor there is quite has an interest in design, and I think it's appropriate for what we do there specifically.
Yeah, absolutely. So here are the 5 questions. Start with the first one. How is your system thinking about digital or addressing digital in healthcare?
So the most awesome thing, not the most awesome thing, but one of the most awesome things at the Cleveland Clinic is if you were to hear my boss, the CEO, Dr. Tom Mihalovich, speak, you would think you're hearing a CIO. So he believes in digital, he believes that's the future, so we have a lot of emphasis on it. So we believe the future is all about digital, so everyone is really focused on taking advantage of that.
Yeah, that's awesome. So second question, how do you determine the noise, signal from the noise, really, in the digital space? There's so much going on. I mean, AI, machine learning, you have all these mergers, you have consumer, you have Silicon Valley, Apple. I mean, how do you determine that's real for us, that's what we're going after, versus that's just noise?
Yeah, it's tough. There's a lot of good ideas out there, and you don't want to miss any. So you need to have good processes. But for us, we're in the midst of developing a strategy for the entire enterprise. And as we're going through that process, we have 9 different work streams that look at everything from patient engagement, caregiver engagement, technology, growth, risk, those sort of things. And all of them touch on digital. And so we're coming together now with a single vision, a single plan. So if something doesn't align with the plan, we see that as noise. We only have finite resources, so we really have to focus. Now, in order that we don't miss anything, we also have a separate innovations arm. So it's quite large. So we have a separate innovations arm. We have a separate ventures arm. So we have a group of individuals who invest in startups and other companies. So that's our ventures arm. And then the other arm we have is our investment arm. And so we look to them to help make sure that we don't miss anything out there on the periphery.
Makes sense. The thing I like about this interview is I'm going to be talking to smaller health systems. I mean, you're $9 billion, so you're going to have a venture arm and those kind of things. And it's exciting to see what you guys are doing in Providence and Dignity and others that have a fair amount of resources. But those smaller players, every time you say an arm, it has to be partners. They just have to go out and find people that they trust and partner up with them. If it's another health system or an innovation arm or
yeah, and we believe the same. We do the same. So we have partnership relationships with a couple of companies or that are emerging that we're going through the process right now, because we believe one is too small a number for greatness. So we can't do it all. We don't have a lock on all the innovation that's out there. So we definitely look to partner with other organizations.
So, third question, if you were talking to every CIO sitting here right now, it's a Chime event, what's the biggest opportunity in health IT right now?
It's not blockchain. I think the greatest opportunity is for us to become better partners with the business. So I still see a disconnect generally between IT, technology, and all the capabilities we have and the rest of the business. So rather than telling you some sort of technology, give you a technology answer, I really think it's shoring up that relationship. And for us CIOs to step up as a business partner, I'm even still learning that. I learned it. We went through this process recently to seek funding for a major project, and I learned it again, and I learned more about myself. I learned more about process. I learned more about how important it is that we are seen as equivalent peers to the other senior executives, and that we are a partner.
Yeah, I love that answer, because I think one of the biggest opportunities we have is our roles going from hero to a teammate.
Yeah.
And that's a huge shift, and for us, that's a burden off of us, but it's also an opportunity to speak into strategy.
Totally. That's so much fun. Like I said, we're developing strategy now as an executive team, and all of these work streams, the common thread is IT, technology enablement, digital, and so now's the time to step up and lead. It's not like, so the other thing that gets me sometimes is IT people say IT should never be leading a project, you always have a business sponsor, and I don't believe that at all. I think in the old days that was true, but if we consider ourselves equals at the senior table, then we better step up just like any other person at the table and lead. And so I took ownership actually today of a huge initiative, probably the biggest one that's going on in the health system. And first in my back of my mind I was like, well, no, it should be this other person or this other person. But then I thought, no, why shouldn't it be the CIO? So.
Absolutely. Fourth question: what is the biggest threat to the traditional healthcare system today?
Well, I think there's a lot of things, a lot of challenges that we deal with, and I think it's a little bit dependent on the organization and where it sits, and in terms of penetration of value-based care and those sort of things, and the payer mix. I think we are threatened by extinction. So because we are so traditional and haven't really embraced this whole concept of the digital, we're going to go away. Brick and mortar healthcare largely is going to go away. There will always be specialty need, but by and large, we need to be thinking what's coming down the horizon, and I think it's only 3 to 5 years away. So, for instance, one of the things that we're working on now is hospital at home. So our tertiary care center is 100% occupied, and that's not necessarily a good thing. So how can we keep patients from being admitted? They don't want to be admitted, so what can we do to help them convalesce and heal at home? So we're looking at in the digital space to help us with that. And so I think the biggest threat is that of extinction if we don't start thinking that way and picking up clues from other industries, whether it's Amazon or my financial insurance company, USAA, very, very progressive. And if we don't start learning from them and making changes, then we will be extinct.
Yeah, absolutely. Dr. Klasko just gave an interview, and he talked about their health system talks about a health system without an address.
Yes.
No distinct physical location. He said he believes that's the future. I've heard him say that. I've heard Rod Hochman say it. Now I'm hearing Cleveland Clinic. So the leaders are really recognizing that the model is changing, and that's disruptive.
Yeah, I call it the fourth dimension, and I always try, as we're going through the strategy process, I'm always reminding myself and my peers that we need to think about this other dimension, because it's so easy to focus on the brick and mortar and the way that we know practice today, but we have to be thinking in the future, and it is this sort of virtual health, and that we'll have a relationship with you even after you move away from Cleveland. So let's say you're a young person, you graduate and you move out, we still want to be your care provider, and we can do that through virtual care.
Oh, absolutely. Here's my last question, and I sort of had fun with this one, but may not be appropriate for you because you haven't been there for 3 years, but if you could rewind the clock 3 years, what do you wish you had focused on 3 years ago that would prepare you for what's going on today? I mean, you weren't there 3 years ago. It's kind of an unfair question, but if you were there 3 years ago, what do you wish? I mean, obviously the blocking and tackling is easy stuff, but is there an emerging technology that you're like, man, I wish we'd gotten ahead of that?
No, I think we're, so I'll answer from a year perspective. I think we've brought the appropriate amount of attention to emerging technologies, and we're starting to push the envelope a little bit. So we're doing some pilots, like hospital at home that I mentioned. we're starting to push the envelope a little bit. I think the area that I would have doubled down on is just the team stuff. This is all basic, and everyone listening probably knows this already, but I know it too, but I still suffer from it. Building the right team from the get-go and making hard decisions right away. So I knew certain decisions in terms of developing the team, and I waited and I waited and I waited, and then I had some false starts. So if I could go back, it would be really focused first on that team.
Fantastic. Well, thank you for your time.
My pleasure.